Hello everyone, it's me Ismail and you are watching VetstudybySAAT. So today we will be discussing about the canine case study series episode 2 about a leptospirosis in dog. So let's study. So we have a dog here, 8-year-old dog, evaluated for acute onset of vomiting, lethargy and increased thirst and urination. Physical examination, it was estimated to be 7 to 8% dehydrated, had a tense abdomen, and the kidney was slightly enlarged on palpation and a large bladder was noted. However, the body condition score seems nice, which is 5 out of 9, and the CBC and the serum biochemistry panel urine analysis were performed. Here the hematocrit value is low, platelets is also low, white blood cell seems normal. Creatinine is very high, urea is also very high, glucose, sodium and potassium seems normal, but phosphorus is very high. In urine analysis, the collection method cystocentesis. This is the method of injecting needle directly into the urinary bladder to extract the urine. The color appearance is yellow clear. Specific gravity is 1.022, which is normal but is declining. pH is slightly acidic, which is good. Protein is negative. Glucose is positive. This is a glycosuria, glucose in urine, and sediment is inactive. So the question is, how would you interpret the finding in this dog, and what are the differential diagnoses for this dog? So let's interpret this finding first. So this dog has renal failure. Why? Because there is the presence of increased serum urea and creatinine, glycosuria but normal glycemia. There is glucose in urine but the blood glucose level is normal. This suggests renal tubular injury. In normal case, only when the blood glucose extends the threshold level, the glucose is passed into urine. But here the blood glucose is normal, but there is glucose in urine. So this suggests renal tubular injury, whether it is acute renal injury or chronic renal injury. Since the history had said there is acute onset of vomiting, lethargy, and the body condition score is also very good, which is 5 out of 9 is good body condition score. So this suggests this is acute kidney injury rather than chronic kidney injury for this dog here. But here the confusion may arise. Here the hematocrit value is low. That happened in case of chronic renal failure. However, the platelets value is low. This happened in acute renal failure. So this case is a acute renal failure case. And this decrease in hematocrit value may have been caused due to vasculitis caused by Leptospira. So this dog's acute kidney injury will be non-oliguric grade 3rd, according to the grading system suggested by the International Renal Interest Society. And the next question is, what are the differential diagnoses for this dog? So let's discuss about what will be the cause of acute kidney injury. So number 1 can be due to ischemic event secondary to hypovolemia. Another will be infections in case of leptospirosis or pyelonephritis, inflammation of the kidney, or can be neoplasia, renal neoplasia, or due to toxins like ethylene glycol or NSAID drugs. They also cause acute kidney disease. And based on the clinical findings, which is thrombocytopenia, decrease in platelets level, azotemia and glycosuria, means presence of glucose in the urine, this suggests that leptospirosis is a likely underlying cause, and more than half of the dog with leptospirosis are thrombocytopenic, and glycosuria is very common finding in this disease. So case 2 is the same dog as case 1. On abdominal ultrasound, the kidney were slightly enlarged and a small amount of perirenal fluid was evaluated. The leptospirosis is suspected as the underlying disease. So how would you make a specific diagnosis of leptospirosis, and how would you treat this dog, and is there a risk of human infection when handling the dog? So how would you make a specific diagnosis of leptospirosis? You can never go dive into diagnosis just in the aspect of clinical signs and symptoms. So the best method for the diagnosis of leptospirosis is microscopic agglutination test, MAT test. But the MAT test can be negative in the first week of illness. Therefore, convalescence titer, that is 1 to 2 weeks after the acute titer, is recommended. And a 4-fold increase in the titer indicate the recent infection. However, given the widespread availability of new 4 serovirus vaccines and the inaccuracy of the MAT, use of a single titer for diagnosis is no longer recommended, and a 4-fold titer increase must be demonstrated to confirm the diagnosis. And another test is PCR. PCR assay for use on whole blood and urine is also suggested, or is also available, so you can do PCR. PCR is very specific, but it may give false negative results, especially in dogs that have already received the antimicrobial drugs. In clinic, ELISA antibody tests are also available, but this may be negative early in the course of infection, and positive result can occur as a result of recent vaccination or subclinical exposure. So how would you treat this dog? So let's make a conclusion here of the specific diagnosis. MAT, we can do PCR, we can do ELISA. So how would you treat this disease, or how would you treat this dog? So this dog should be treated aggressively for acute kidney injury with intravenous fluid and other supportive treatment while waiting the result of further diagnostics. It is commonly found inside the macrophages, but it can sometimes exist outside the cell also. So doxycycline is recommended. The oral doxycycline is recommended for the treatment of leptospirosis, but in case of vomiting dog, the oral medication should not be given. So intravenous medications like intravenous doxycycline or intravenous amoxicillin can be given until the vomiting subsides. And once the vomiting subsides, treatment with doxycycline for 2 weeks is recommended to eliminate the Leptospira from the kidney. However, the drug affecting the kidneys should not be given because it will potentiate the renal insufficiency, because Leptospira mainly affect in the kidney, liver and blood vessels, causing nephritis, hepatitis and vasculitis. So other drug like penicillin compound may be used during acute leptospiremic phase if it is unable to administer doxycycline per orally. The next question is, so is there a risk of human infection when handling the dog? So leptospirosis is a zoonotic disease. Yes, it is a zoonotic disease. That's why veterinary staff or veterinary student should take precautions when handling the dog with this disease or the dog suspected with this disease. So the contact with the urine should be minimized because the Leptospira excrete through urine, because this Leptospira is a spirochete and it is said in urine, and it can penetrate the intact mucous membrane or if there is any wound or abrasions in the skin. So gloves and a gown should be worn, and pregnant women should not be in contact with the suspected dog having the disease, and the precautions should remain in place until the dog have received at least 2 or 3 days of appropriate antimicrobial drug therapy. So that's it for leptospirosis. I hope you understand. If you have any queries, feel free to comment down below. I will explain it to you. Thank you so much. See you. Bye bye.